Hey guys, Dr. Truesdale here. Today we're going to talk about facial reanimation. I recently performed a temporalis transfer surgery, which involves taking the tendon from the temporalis muscle and disconnecting it from the jawbone that typically helps us bite down and transferring it to the corner of the mouth to use that same muscle to help the mouth smile. Give back a smile. Today I want to review some simple yet effective techniques to retrain the brain so that you can use your bite to actually produce a smile. Let's dive in. Technique number one. A lot of what I'm going to go through involves using a mirror. So you'll use your mirror, and looking at yourself in the mirror will allow you to create a mind-body connection or muscle connection. And it will help give you the sensation and feel the sensations, see yourself and get that feedback of what produces the result for you. Let's start with the first one, mirror feedback, okay? What I want you to do is just sit in front of a mirror, okay? And gently clench your jaw. Clench your mouth, clench your jaw, and just observe what it does to the corner of your mouth. This is purely just to see what happens, the motion that gets transmitted from the direct bite to the corner of the mouth. Try this about 10 to 15 times a day, okay? That's the first example. Let's dive into technique number two. So still sitting in front of your mirror, I want you to place 2 fingers at your temple, and I want you to look in the mirror, and I want you to basically bite down gently and focus on the connection between the biting and your smile. Think about pulling the corner of your mouth up and out as you bite down. That's exercise number 2. Do that about 10 to 15 times, okay? Exercise number 3, soft open bite. What I want you to do is take something soft, like a cotton roll here, and I want you to gently place it into your mouth and bite down between your molars, okay? I want you to bite and imagine the smile happening at the same time. And you can do this also while looking in the mirror, okay? So again, take the cotton, put it between your molars, bite down, and concentrate on looking at what the effect is of the movement at the corner of your mouth, okay? Repeat this exercise about 10 times daily, okay? Great. Phase 2. Phase 2 is all about initiating a smile movement. You typically can start this around 2 to 4 weeks after surgery, okay? Now that you started activating that muscle, we're really going to try to start moving the corner of the mouth to really simulate a smile, right? To create a more smile-like motion. Exercise number 4, we're gonna smile with a bite. So what I want you to do, again, look in your mirror, and I want you to just bite down and lift the corner of your mouth into a smile. Okay, use a mirror. Make sure that the smile looks even and in the right direction, okay? Do this about 10 times a day. Perfect. Exercise number 5. Call this visual targeting. What I want you to do with the mirror, I want you to put a small dot or a sticker and put it on the mirror where your corner of your mouth is intended to go when you smile. So you start with a neutral face, okay? And then mark on the mirror where you want the corner of your mouth to go. Then I want you to bite down and then actually force the corner of your mouth there, okay? When you're biting, visualize the corner of the mouth actually lifting to that point that you've marked on the mirror, okay? It's a great way to track control and to create that mind, muscle, lip, corner of mouth connection, okay? Really great for smiling. Exercise number 6. This is called a smile hold. What I want you to do is basically build the muscle and endurance of the muscle. You begin this by holding your smile after you bite, and I want you to hold it starting off at about 5 seconds and then work your way up to 10. So as you're looking in the mirror again, what you're gonna do is you're gonna bite down and you're gonna get that smile. And I want you to try to hold it there. Basically, it's a muscle. And so we need to retrain that muscle and make that muscle strong. So this is like going to the gym to lift weights. Focus on that mind-muscle connection. Exercise number 7. Now this is after you've made some progress, already kind of initiating that movement. We're now going to work on dynamic movement in normal scenarios. So exercise 7 is speaking with a smile. What I want you to do is look in the mirror again, and I want you to hold it up, and I want you to smile while saying small phrases like thank you, okay? Or hi. Biting down, hi, okay? Thank you. You'll find that your ability to kind of animate will start to begin here, and you'll want to work on this. Try it gentle, try it natural, okay? Also try forceful movements. See how your face responds to different levels of bite as you speak. This will be important as you incorporate your new smile into your everyday life. Exercise number 8, emotion expression. So what I want you to do is take a look in the mirror again, and I want you to try smiling while you're waving or while you're brushing your teeth in the mirror. This helps bring out a new type of smile, a more realistic type of smile movement. And I want you to practice this every day so we can rebuild a normal, natural smile. Now it's going to be different because you're going to be biting down to produce the smile, but if we can train your brain into using this smile to emote your emotions in normal day life, well, that's the goal. I want you to record your progress. So each week, take a video selfie of you biting down and seeing the type of smile you're able to elicit. Each day, each week, you'll get better and better. And this will give you encouragement as you progress along your training, okay? So we reviewed a bunch of exercises. Remember, facial reanimation is a journey, not just surgically, but also in terms of rehabilitation. Hopefully these exercises have started the whole process for you, and it's something for you to look at, practice every day, and begin making stronger your mind, muscle, body connection, okay? So if you guys have any questions, reach out to my office, but I can't wait to see those beautiful smiles.